I'm Jayshree from SNS College of Technology. So I am proud to be the institution. SNS institution is the first design thinking institution, and also we are going to implement the Gen AI. So we are going to discuss the case study topic about IoT. So let us see in detail.
So hi guys, I'm Riverside. Today we are discussing about a serious IOMT failure at Riverside Hospital. The IOMT system has been stopped for 20 minutes and didn't update any patient data. Because it is a serious issue, because IOMT has been monitored for real-time updating patient data. Before we move to causes and solutions, I want to ask this stop of the system because due to poor launching or human error. So let us hear your.
From a technical side, the failure likely happened because of weak network connectivity. Weak network connectivity is one part of the hospital. Overloaded server, since many devices were connected at the same time. No backup communication system. So once the main server failure, it's everything stopped. Even a small delay, it can be risky. So I feel the root cause is poor system design.
So hello all, I am Shobika from SNS College of Technology, currently pursuing biomedical engineering, third year. In hospital perspective, the nurses depends on real-time alert to respond quickly during the failure. Staff help to every patient that increases stress, confusion and delay. So this is lack of training. This lack of training may cause very dangerous for the patient in Riverside Hospital. So we need to train all the nurses and staffs in a hospital.
Hello all, myself Jayavati from 3rd year biomedical engineering at SNS College of Technology. To avoid this problem in the future, hospital should added a backup IOMT server and then use AI-based failure prediction to detect system overload earlier and then train staff on manual emergency steps. Improve Wi-Fi or Bluetooth network inside the hospitals. Use edge computing so some prediction happens near the patient device, not only the control server. Overall, IOMT is very useful, but it needs strong planning.
Okay, let me start. So first of all, we are discussing about the Harvard University, which is being connected to the Riverside Hospital. So this hospital has been the main hospital and very popular hospital all over India. So this hospital, we had a patient. He was continuously monitored and he was connected to various equipments like the ECG, the SpO2 level, the patient monitoring system. These all were connected to him at the same time. So at that time, in a particular day, for 20 minutes, over 20 minutes, because he was continuously monitored, and for the 20 minutes, he was not able to breathe or give any signals also. And the ones which were monitoring him also was not able to give any particular signals or the ECG signals or brain signals, anything, nothing was given by the patient monitoring system. So there was a very bad impression, very critical situation of what is going between the patient. So the patient was in a critical thing, but still the doctors were not able to find what the problem was or what was happening, if the mission is at failure or the patient is having any failure, what kind of disturbance has been happened, nothing was being able to explain by the doctor. So we might think that the hospital is big, we will have a safe and secure treatment, we will not be able to get into any kind of problem. We might think that, but actually, even in a small situation, even if there is a small leakage in that medical device, it can bring a very big bad thing to the patient. So each and every equipment has to be calibrated every month. The hospitals have to be checked very properly. Before getting into someone's life, the patient is obviously in a critical situation. So the hospital has to be very ready to maintain those kind of critical things. Not only this, we have introduced AI system, we have introduced a lot of advanced systems in the hospitals, but still these kind of things keep happening to the patients and we lose a lot of life. Even though we will be able to secure their lives, but we are losing so many lives because of the carelessness or because of some issues that have been happening in and around the hospital. So maybe we are responsible to make them get into a good secured life. So that is what we are here for. They have made a mistake once. Maybe we shouldn't get into that same problem over again. So we have to learn what we have to do in that critical situation, what has to be done, what the doctors have to do, or what the hospital should have to secure their lives. So I think this case study will tell us what we have to do in this critical situations so that these kind of things won't happen. The 20 minutes doctors and nurses were running here and there to check what that patient's situation was. So we might not get into that problem. We have to follow all the safety precautions, the protocols that have been released by the medical department. These IoT systems are very good. Specifically, we are focusing on Internet of Medical things. So medical in the sense, it is very much important than other things which we are using in the IT field. So we have to make sure that nothing is being disturbed in the particular field. We have to take these things into more carefulness.
So finally it is concluded that IoT is mainly used for hospital to diagnose the diseases, not for any patient abnormality. So mainly the doctors are used for to diagnose and what is happens and what is abnormality of the patient. After that they go in for treatment. So thank you all. Have a nice case.
Thank you.